we know from decades of research that Life Simple 7, or cardiovascular health, is one of the most important pieces of preventing cardiovascular disease risk. So the cardiovascular health score includes 7 of the most important metrics for cardiovascular health. And in 2010, this was really a major focus of the AHA. And moving forward, lots of studies have shown that higher cardiovascular health is really associated with lower risk of cardiovascular disease. And a few studies have looked at the population impact of cardiovascular health in US adults for things like mortality, so all-cause mortality and cardiovascular disease mortality. However, much less is known about the population level impact of cardiovascular disease events, so both fatal and non-fatal. And this is a crucially important question because not only is cardiovascular disease the leading cause of death, but it's also a major cause of disability-adjusted life years and is a huge financial burden on the United States. So really what our goal was with our study is to look at the population level impact of cardiovascular health on incident events in US adults. And so we did that using a method that borrows from population impact analyses using the population attributable fraction. And basically what this is it's a metric of basically an association in the whole population. So it's a function of both the prevalence of exposure, in this case cardiovascular health, and also the magnitude of association of that exposure with events. So what we did is we used 3 data sources, so US nationally representative data from NHANES to estimate the prevalence of cardiovascular health levels in US adults, and then we used data from the Lifetime Risk Pooling Project to get incidence data on cardiovascular disease. And so this is a pooling of more than 30,000 US adults. And so we combined those 2 things to estimate the population attributable fractions of cardiovascular health levels in US adults. And what we found was that 7% of US adults have high cardiovascular health. So that's a very uncommon finding. And we found that if we could take everyone in the low or moderate levels of cardiovascular health and move them up to the high cardiovascular health level, we could prevent almost 2 million cardiovascular disease events per year. So this is a gigantic potential impact, but we also did an analysis to look at if only fractions of adults were able to achieve high cardiovascular health. And we found that there would still be really substantial benefits to improving cardiovascular health just a little bit in US adults. So really what this tells us is that all of our efforts towards primordial prevention of these 7 important metrics for cardiovascular health before they get to the so-called disease states could really have huge population benefits for preventing the burden of cardiovascular disease in the United States.